It's that time of year again. You are officially invited. Yes, you're invited to join us in Fertility Awareness Mastery Live. This is my 10-week group coaching program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start the first week of October. Are you ready to jump in? Head over to fertilityfriday.com/fam to register today. That's fertilityfriday.com/FAM. This is the Fertility Friday podcast, episode number 435. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Journal. I'm a certified fertility awareness educator and holistic reproductive health practitioner with nearly 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormonal health, and optimizing the menstrual cycle without hormones. I'm outspoken about hormonal birth control and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I teach women's health professionals how to utilize the menstrual cycle as a vital sign in their practices, and I host live coaching programs to help you achieve optimal fertility and health, because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys. I know, I'm a busy girl, but I managed to fit it all in. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with me today. Today I'm sharing a brand new episode in the Pill Reality series. I'm sharing my interview with Barbara, and she is sharing her experience with gallbladder disease. So ironically, this is not the first podcast episode in the Pill Reality series with this particular issue, but one of the lesser known side effects of oral contraceptives is the gallbladder issue. And so Barbara shares with us her experience of identifying this issue with her gallbladder, having it removed, and then what the fallout has been since. And if this is a new topic for you, or if you yourself have experienced this before, there is a previous episode of the Pill Reality series with Lucy Fink, episode 369, where she shares her experience with hormonal birth control and gallbladder issues. And she shares her story of having to have her gallbladder removed and what that was like. So those 2 episodes, today's episode and episode 369, are a good combo to listen to, especially if this is a topic that interests you. So without further ado, let's go ahead and jump into today's episode. So I'm excited to be here today with Barbara. Barbara is a member of my Fertility Friday community. And as so often happens with these episodes, I think I had posted something about the NuvaRing, and comments come in, and occasionally I see one and I'm just thinking to myself, wow, I should connect with her. So thank you so much for coming on the show. I'm thrilled to have you.
Thanks, Lisa. I'm really happy to be here.
Well, so let's just kind of jump right in. So my favorite question to ask with these interviews to open everything out, how old were you when you had your first period, and what was that like? And kind of let us know what led you to use hormonal contraceptives and, how that all went.
Okay. So I got my first period. I remember it was Labor Day, and it was 1995. So I was almost 12. My birthday's in October. So I was 11 years old, and I remember it being like a surprise, and it was painless, and there was just a little bit of blood, and that was it. And talking about periods in my house was pretty taboo. So I was basically shown where all of the pads and things were and told to say whenever I needed anything. And that was kind of it. So I think my mom taught me how to track on a calendar, but as an 11-year-old, I did a really bad job. Like, I didn't keep track very well. And so I just have like spotty memories of like, do I need a pad at school? Do I change it at school? And then I was on the swim team my sophomore year of high school. And I remember like trying to think through like how I negotiate that swim team. But it never seemed to be like a major problem. Like, we also didn't have tampons. So like I didn't bleed swimming, and it just didn't seem to be an issue, even though I was anxious about it. Yeah, that brings me through like 1999, so like age 16. And it was age 17 when I started to use contraception, and I used condoms because I think I've heard you say, like, I grew up in the era where like condoms were like totally normal and recommended. And my mom and family weren't really into birth control. So I didn't have any exposure to that. Later in college, I did try birth control and maneuvering. But at first, I just tried condoms, and that seemed to work. As an aside, it was like this crazy thing. The culture around sex at that time was like, oh my God, don't get pregnant as a young woman. Your whole life will be over. So like there was that chunk of time in my life where it was just like, don't get pregnant, don't get pregnant. Like there's no education, but don't get pregnant. Like, so condoms it was. And like, even the people I was with were also like terrified to impregnate me. And I'm like, it's the worst thing ever. But like now as a person with a child, like it just blows my mind. But then that's just the way that it was.
Oh, this is so interesting. So you and I are probably around the same age, I think.
Perhaps.
And yeah, we're pretty close. That's so interesting that you said that, because I obviously have talked about this a lot on the show, but I never thought about the other angle, which is so true. When you said that the other person was also really interested in not getting you pregnant, that was also a characteristic of this age group. And I think that's one of the reasons why I can't understand why it seems that so many men don't want to wear condoms, because back in that time, it was like, if you have sex, you'll get AIDS and die and you'll get pregnant, right? And that's the worst possible thing, right? Like that was the whole story.
Right.
And so everyone, I don't know, I was scared of AIDS. Like they used to, I feel like the 90s, everything was so severe. Do you remember those commercials? Like, this is your brain. This is your brain on drugs. Like they used to take an egg and crack it and like fry it. And like, this is your brain on drugs. And MAD had all those campaigns. I remember going to the big city, because I grew up in a small town. So I was going to the big city, and I can't remember much, but I remember being in this room. It was like a movie theater. And they showed you all these like people getting car accidents, like these mangled people and whatever. Don't drink and drive. Like it was like, I feel like the 90s was so extra with all of the public service.
Yeah, like scare tactics for sure.
And it worked.
It did. It did.
Well, so just to take a couple things I wanted to ask about. So you got your period when you were 11. I mean, that's kind of young. I know it's pretty average. I know like a lot of girls get their periods around that time, but it's just so interesting how you described it, that it wasn't really something that was talked about a lot. It was kind of like, you just have to take care of it. Obviously a big deal wasn't made about it, but yeah, like at that age, was it okay? Like, were you kind of the first of your friends? Were you expecting it? Was it a surprise?
So I wasn't expecting it. I had some like very brief education in school. We grew up pretty religious, and then my parents would actually send in notes to like avoid sex education. So there was a lot that I sort of had to piece together on my own. And I think my parents also knew that about me, that I just figured stuff out. So like the communication was not really great, partly because everyone was embarrassed, but also partly because I think they're just like, here are the pads, figure it out. And like, I did, it was not fun, but I was the oldest child of 3 girls and 2 boys. And so I didn't have any role models. And like, I think I had one best friend, and like we did talk about it, but it wasn't like, we didn't compare notes. It was just like, oh, I have my periods, the end. So it wasn't like, I mean, we're in the Northeast in Connecticut, and maybe that's part of the culture too, like being a little bit closed, a bit colder, like only letting a few people in. And I've had people tell me from other parts of the country that that's what we're like. But to me, it just seemed like normal.
Well, I mean, I feel like I can relate to that, because as much as I talk about, vaginas and periods and cervical fluids and things all day long, it's I distinctly remember that when I was a teenager, it's kind of exactly what you said. You would kind of know, like when a girl got their period, they would kind of tell like if they wanted to. And so you kind of knew who had gotten their period. I had my period when I was 14. So I was a little bit on the later end. I was ready. I was, waiting, like, when is it going to come?
Right.
That was the extent of it.
Yeah.
And no one really talked about, I mean, maybe a little bit, who used tampons, like, because everyone didn't use tampons. So maybe there was a couple of people who used tampons, and
Or like misuse stories. Like I had one friend who was like, I had the applicator in and I rode my bike and everyone was like, no, like terrible things like that. But like that happened to a
even
person
that,
because they didn't know.
I don't think that would have been something that my friends would have.
Oh yeah. Like, that was years later.
Would not have been. Yeah. At the time. But I remember because my mom got me a subscription to YM. So now I'm telling everyone how old I am. So whatever that means, but
that old to me.
But back in the day, I was really into that YM magazine, Young Miss. And so it was, that was it. That was the whole thing. Every magazine had this page where they had like your horror stories. It was always about periods and it was always about that kind of stuff.
Yeah.
So, it wasn't until I was an adult, like legally an adult, that my girlfriends and I started having more conversations around it. And I remember in university, that was more of the time when I was getting into the fertility awareness stuff. And that's when I was learning about alternative menstrual products. And I feel like that was more of the time when we started talking about sex and sex positivity and all that kind of stuff.
Right.
So yeah, I can really relate to your story. And there was one other thing, because I had a different experience as my periods were heavy from the start. So there's no way I would have bled through that swimsuit. Like, so you're not the first person I've heard to share that you just kind of wouldn't wear it and it would be okay. So that's also really interesting.
Yeah, no, it was fine. And it was kind of like, I was always just worried about it. And then like extra careful in the beginning and end of like swim practice, but like I didn't bleed in the pool. There was nothing on the swimsuit. Like it was really pretty mild there for a while.
Mm-hmm. Well, and it's interesting, your experience also, this is something, it makes sense. So it's a lot of our experience is in a way based on things we're exposed to, whether it's our friends or a family member. And so certainly you're not the only person I've spoken to who's told me, well, my parents weren't really into, like my mom wasn't really into hormonal birth control, so that I stayed away. It's very interesting. So in your case, then it sounds like you had a pretty typical cycle. There's nothing that you're remembering or sharing that was problematic. And when that is the case, typically it means you had a cycle pretty regular-ish and not a lot of problems.
Yeah, not very memorable and not a lot of problems.
And so then
early on.
Yes. And so then you were using condoms initially, and then you decided to try hormonal contraceptives. So share a little bit about that and kind of what brought that up, like what made you jump in.
Okay. So when I started college, I had access to the healthcare there, and that was actually better for me than access at home. And so I'm not actually sure what prompted me, but I knew that like I was interested in trying it. I guess I don't actually know what prompted me to start it, but I started ortho tricycline in my freshman year. And I remember not liking it. And I remember moodiness, but not really terrible. And then when my relationship ended, I ended it because I was like, I don't need this, so I don't want to deal with it. But I don't remember it being like terrible. So, and I don't remember like, when I'm anxious about something or I'm watchful, I set alarms. Like I was pretty good about taking it at the same time that I needed to every day. I don't remember that it like changed me in any sort of real way. Maybe some acne. As I look back, there's a lot, Lisa, that I realized like looking back that I connect the dots. And this part of this realization of like, oh my God. And that's kind of what happened with NuvaRing. Like it took me into, I know I'm jumping ahead, but it took me down like memory lane, and I was like, oh, okay.
Well, in your case, you had something to compare it to as well. Like you had that's a significant period of time. I'm guessing you're in your 18, 19, 20-ish age. So that's a good, from 11. Yeah. That's like depending on the age specifically, that's 8-9 years of regular cycling. So you have, in your case, you had something to compare it to.
Right. Where it's like, it wasn't really a problem. And then birth control. So that relationship ended in basically 1.5 years. And then I went off of it because I didn't want to be on ortho tricycline. So, and then after that, I just used condoms if I was with somebody, and I started a new relationship, but then I studied abroad for 1 year. And so I didn't start any birth control then because it was a brand new relationship. So I was okay with using condoms. Like he was okay with using condoms. It was working for us. And we also didn't see each other that much because it was like the summer, and then I studied abroad and I was doing a lot of working. And then I studied abroad and we stayed in that relationship, but I didn't see him. So I wasn't sexually active across the world. Like, so I had like another year of just being naturally cycling. And then when I came back from that, I was like, all right, we're home all the time. My friend, I have a few close friends, and one of them suggested the NuvaRing because she had started it and she liked it. She liked that it wasn't a pill. And I think she even said like, oh, you can just put the other one in and skip your bleed week or something like that, which I wasn't comfortable with, but like, and I think, yeah, no, I'm trying to remember. I'm sorry, it's a long pause, but I was trying to remember. I think I might have started seeing her PCP too when I was home from school, which I think will come into play later. But anyways, so I started the NuvaRing, and so I'm now on like the later side of the college years. And at that point, I didn't know that this was happening, but I was super moody, super anxious. Like, I think I tend towards anxiousness, but like what really didn't work for me, there was like this huge dissonance because I had just come back from a year of living abroad by myself, speaking a different language, doing all of my admin tasks, like talking with professors, doing projects, presenting in a different language, like traveling all over the place and doing things. And now I couldn't like walk up to a bank teller and ask them what I needed without like fumbling over my words and stuttering. And like, I was so anxious that it just didn't make sense. So the anxiety, that was like a big one. And then I think, I was dealing with some major stress because I came back from that year that was so awesome, and I had to work a lot because I was not going to take out any more loans. So I was like taking on full-time work at the same time as finishing up my coursework and hanging out with my boyfriend and doing all the things you do. And I remember being just so stressed out and so unable to cope that one day, like I was just talking with him about everything. I just started to cry and like threw myself down on the ground in the quad, like where people would walk to go to the dining hall to have a meal. And I was just like crying, like an adult tantrum. And like, it was so embarrassing, but I didn't even care because I was so overwhelmed. And I did not put any of it together that maybe it was the birth control. Like, I know that there were other stress factors, but like, I was able to cope through very stressful things, like being abroad. So it didn't make sense to me. And then the other thing that really bothered me was in the mornings, I frequently would have nausea. And it would happen so frequently that I was just like, is this what pregnant people feel? This is ridiculous. And I would feel so miserable, and my thoughts would just kind of like accelerate. And I get so angry at people who are probably feeling better. And my thoughts were really scary. And I consider myself a gentle person, kind person, someone who probably puts themselves last too many times, like who thinks of the other person, but I was having really scary thoughts. And that was one of the things that just was like, this has got to stop. But I didn't think of it being the birth control. Like, I didn't think of it as being the NuvaRing. I just was like, something is wrong, but I didn't do anything about it. I just was like, I gotta cope better. Like, maybe I'll quit my weekend job because it's too much. And so after graduation, that relationship ended. That was sort of like a big thing, but I went off the ring, and because I wasn't going to be with anybody. And now that I'm thinking about it and going through all of it, I was at my maximum weight. The weight had crept on, but like, I wasn't aware that it was potentially the ring or anything. I definitely had skin issues, more acne. Now, I think I had acne like all through my teens and everything. Like, I'm sensitive to like sweets and things. And if I don't eat well and I'm stressed, I get more acne. But I think this was worse. And I remember the last NuvaRing that I had in, I was just like, I was afraid I was pregnant because something was wrong. Like, I knew that the cycles weren't regular, even though I was following all the instructions like I should. So like the last NuvaRing went out, and I was like, I just need to have a period and know that I'm not pregnant. And I wasn't, but like, I was really afraid that I was, like, because I was trying to be responsible and avoid pregnancy. Yeah. So that's when I ended it. And I just told myself I wasn't going to go back on it because of how bad it made me feel. But I didn't seek any medical attention or anything. I just sort of went on with my life. And I started a job and I moved in with some of my girlfriends and I started with her PCP. And that was when I was told I had metabolic syndrome and had to lose weight. And I was told to try a low fat diet. And so I did that with gusto. But then, of course, you can't always do a low fat diet. So then you go out and you have something with fat in it. And my gallbladder started up. And I'm like, I was 24 years old and I had an emergency room visit because of gallstones. And then I had another emergency room visit because of gallstones. And then I had a surgical consult. And I went to my primary care doctor and I was like, well, why does this happen? And she's like, well, you're female and you're fair and that can just happen. And I can see your face.
I'm sorry. Like, you're a white female. That's the
gallstones. And it's not like it runs in my family. Like my mom actually has gallbladder issues, but like she's lived with her gallbladder for years.
Well, and it was when she was pregnant. Listening, that's a risk factor for gallbladder disease. Just being white female. I'm sorry. Like I can't even help myself. I'm gonna stop.
I knew you'd love that one. Not me.
It never ceases to amaze me the nonsense that comes. So this isn't about throwing doctors under the bus, but it's about recognizing doctors are people, and some of the things they say are not necessarily a result of their degree and education.
Or they could say they don't know, or
that would be more appropriate,
perhaps,
and accurate.
Yeah. So, kind of not knowing any better, you can kind of hear my regret in this. I went ahead with a surgery in April. So I think I went off NuvaRing in October, and I was getting my gallbladder removed via laparoscopy in April of 2008. And I had a C-section with my baby. It was probably worse than the C-section, and my digestion changed forever. So like no one told me that there was going to be side effects from the surgery. Like, oh yeah, you'll have your gallbladder out and then life will go on. So I sort of wish now, and like I didn't have many hippie friends, many people who like would try natural methods of healing. But later on, I had a friend who was like, yeah, I'm just trying to get rid of some gallstones, doing this, doing that. And I'm like, wait, there's a way to do that. There's a way to know that you have them, one, and then also manage them potentially. Now, I don't know all the ins and outs of that and how well it worked, but she still has a gallbladder and I don't.
Well, so let's dive into, first of all, thank you for sharing your story.
You're welcome.
Jump in there and like,
I know it's not a long story.
Your doctor.
No, but I mean, this is what I mean by like looking back over time and then seeing that there's like potentially a connection. And then realizing like, oh my God.
Yeah. So as I mentioned to you, I had a number of kind of client sessions and things like that today. So it's been a work day for me, but I kind of lost my train of thought there. But okay. But one of the things I've said a couple of times today was there's a lot of things outside of our control, so one of the things I try to do to maintain sanity is to focus on what's in our control. So from that bigger picture standpoint, that's obviously why I do these Pill Reality series and why it's just a kind of standing part of the podcast where it's just a part of what it is. It's important because you're not alone. Most women who take contraceptives are not provided with a full side effect profile. And we can, at the end of the day, I think that the whole idea that we shouldn't be sharing that information it doesn't even make sense. We're not so stupid that we can't understand that everyone who takes the medication doesn't end up with gallbladder disease. Like we're not that stupid. You know what I mean? Right. So I feel like there's no reason why we can't just be provided with a full side effect profile. So I can't stand here and say, definitely the NuvaRing caused all these problems, but so I have this post series on my Instagram, and I've been very slowly, but going through all these different types of contraceptives. And I literally do a search for NuvaRing, for example, prescribing information, which anybody can do right now. And PDF if you want. And so, because all of these drug companies are required to provide the prescribing information. Right. In order to come up with prescribing information, what that means is they had to hold clinical trials. And they are required to report all of the side effects. And so when you read these documents, it's very interesting because it's right there in black and white. And so generally speaking, with these contraceptives, the stuff that they're telling you is mood changes, depression, anxiety. They're telling you weight gain. They're telling you irregular bleeding. Often they're telling you acne, nausea. They're telling you like ectopic pregnancy, because at the end of the day, there's no method that is 100% effective. And so with some of the methods, I think I just posted, but a lot of them, so maybe a little bit more high for the IUD, but the issue is that these methods kind of prevent pregnancy. Obviously, that's why they work. But then if you do get pregnant, there's often a higher risk of ectopic pregnancy. So that, that piece of information, but the gallbladder thing, it seems so random if you've never heard this before, the gallbladder connection. But then when you pull the prescribing information and see that it is written on the thing, it means that when they did their clinical trials, there were women who took the drug as directed and then got gallbladder disease. That's what it means.
Yeah.
So then tell us a little bit about the fallout, because this is one of the challenges too. I think the topic of advocating for yourself and taking time has come up on a few podcasts, but again, you're not the only one when you go to a doctor and then you had a legitimate health issue. And of course, from the medical perspective, they're going to say, okay, well, you need to get this gallbladder out, and we need to do it sooner than later. And there's always this kind of push to do everything now. And unfortunately, many of us don't even realize that we could just wait a month or 2 or 6.
Right.
It doesn't, because they're telling us, and it's a doctor and it's serious. We need to do this now. And,
or they couldn't even grade it for me. You have gallstones, but there's an imminent rupture, and it's going to be an emergency, or there's not an imminent rupture, or we can't tell, or one way or the other. But it always seems like emergency and you have to make a decision right now.
And they it seems to me, obviously not a specialist in gallbladder issues, but it seems to me that they talk about the gallbladder as if it's they call it vestigial, or there's a word or something, basically the idea that, it's not something that we need. We can live without it.
Without it is sort of casual, you're going to be okay without it.
And you won't die without a gallbladder, but it does change your quality of life because the gallbladder helps us to process fat. So it obviously will forever change the way that you digest food. So maybe just talk a little bit about what that experience was like, and maybe even talk a little bit about that experience of going to the doctor and what led you to actually get the surgery.
Okay. So going to the doctor, I was having gallstone attacks and they were really painful, and they would give me an emergency room. Maybe I remember getting an ultrasound once and they confirmed there was gallstones. And then they gave me Valium, I think, to go home with. And I would just lay in bed and cry and try to sleep. And so I was like, I can't live like this. This has to stop. But the only option offered to me was surgery. There wasn't, and I didn't think to ask. I was young, and I was just putting my faith in the professionals that were in front of me. And, there were my friends' doctors. I liked my friends. I respected them and their choices. And honestly, I didn't have great relationships with doctors growing up. Our healthcare was sort of spotty. I think that played a role into it. And then, when I met with the surgeon was all positivity. And now I have friends who are surgeons, so I'm not going to bash them, but that's what they do. Surgeons want to do surgery. And so he was really reassuring. He was really charming. He was we're going to solve your problem, and it's going to be laparoscopic. It's going to leave very little scarring, and you can just be on your way. And so, I knew it was going to be a healing process, and I knew there was going to be pain. He did tell me that, but I didn't know about digestive problems afterwards. And I think too, I was probably also eating standard American diet plus whatever I had learned about nutrition in college. You should eat lower fat, you should eat lots more fruits and vegetables and grains. And there's a lot more that I've learned now that I might disagree with some of those recommendations, but my family culture, the first meal that I got after my surgery was a fast food meal. And I was thankful that they were taking care of me. but I had to immediately run to the bathroom. And it was really hard because I was wearing a belly band because you couldn't laugh without crying because you had abdominal surgery. And so having to go to the bathroom immediately after eating, I had diarrhea. Like, it was embarrassing. And I was like, okay, why? And it wasn't digesting the fats, and it was causing things to just leave immediately. And honestly, like, if I'm not careful today, it still happens. It's just way more controlled. And I know a lot more about my diet. But I mean, it's been 14 years. So I think I know a little bit more at this point. But I do wonder about like fat soluble vitamins and other things and absorption. And I'm still kind of on a journey of figuring out if I'm deficient in some of those things and if there's like any sort of other effects. And, I'm also learning too that the gut is also connected to, well, the rest of your body, but like the gut microbiome is important, and it impacts like also your periods too. And like, I think that inflammation from there has really been a problem for me over the years. And I think, I've been vitamin D deficient like constantly. I think this last year was the last time, like after my test, after my baby, I was like just within normal range, and I'm supplementing constantly. I also had to have my parathyroid out another like in 2014, and I have no idea what that's from. But like, I basically feel like ever since my gallbladder came out, nothing was right. And I've been sort of correcting since then. Like, it's been harder to keep weight off. It's been harder to know what to eat, what works. Like, funny things set my digestion off, like raw vegetables, which are really good for you. Like, so
harder to digest
salads.
though.
Yeah, harder to digest. And I also noticed that I'm really, really sensitive to like processed oils, like anything with canola, sunflower, cotton oils, like those do not work for my stomach. And then it's starting to show elsewhere on my body too. And then my periods were pretty difficult, like after that. And like you noted, I had a period of time where the periods were relatively like, come and go, no problem. But it's only been within the last 5 years that I've gotten to less painful periods, less heavy periods, more regular periods. I had been seeking care for PMS difficulties and was put on Vitex a while back. And that was really, really helpful. You probably have in your head what maybe that means was going on in my body, but I wasn't sure. And I forget where I was going. Basically, it just took me a really long time to get my periods and my cycles back to like healthful, normal, because I always had something like this digestive issue in my body, like as one of those stress factors on my body, I feel. And I don't know that that's what the cause of it, but like, that's the point where things changed for me. I mean, what else? I also had an ovarian cyst that I think ruptured, and that was very painful too. But it was like a year into my marriage, I had that happen. And I had been now off the NuvaRing for about a year and a half at that point. So like at that point, 2009, 2010, 2011, 2012, I was still trying to figure out my periods. And then like, even later when I found your podcast and I'd gone to a naturopath and seen other people, other friends, and talked to them about things, like, yeah, it took a really long, like maybe 2017 was when I was like, all right, things are good.
It's time, ladies. Time to take your fertility awareness knowledge and confidence to the next level. Just popping into today's episode to invite you to join us for the next round of Fertility Awareness Mastery Live. My 10-week group coaching program is designed to help you unlock the secrets of your menstrual cycle. Fertility Awareness Mastery teaches you everything you need to know about using fertility awareness cycle tracking to achieve your intentions. Whether you're currently trying to get pregnant, avoiding pregnancy, or planning to conceive in the future, we've got you covered. This program goes deep. Get to the root of your period problems, hormone imbalances, fertility challenges, and so much more. Early bird registration is now open, but only for a limited time. Head over to fertilityfriday.com/fam to register today. That's fertilityfriday.com/FAM. Now let's go ahead and jump back into today's episode. Yeah, that's so tough, especially when you're not provided with the background information, because you basically, it's kind of similar to the way that your family dealt with your periods. Here you go.
Mm.
We're going to take out your gallbladder, figure it out.
Yeah. Yeah.
Very much the same. Well, and so share with us when you made that connection. It sounds like, right, you had it because you're a fair white woman, like, right, like so it's like, so right, so at what point so basically your doctor didn't, it doesn't sound like your doctor made that connection, even though it's written on the thing, it's written on the prescribing information. And this also points out, I think, an important point for everyone just to always remember that so pharmacy and medicine are two separate modalities. And so often the pharmacist knows more about the medication that the doctor is prescribing than the doctor. And to be honest with you, so if anyone hasn't had this experience, I mean, if you really do have questions about the medication, you could just fact check me. Go to your doctor and ask them to explain to you what's the medication, or the next time, whatever you have a conversation, like, hey, could you tell me about some of the side effects? I've been reading about it. Listen to the doctor's answer. And then if you have to go to fill a prescription or whatever, ask the pharmacist to go through the side effects with you and the profile, and just, you see the difference yourself. So know that. Just as a side note for everybody, regardless of the type of medication as well, it's really the pharmacists that know that's their job there, because they also have to know the different drug interactions. So the pharmacist is going to be the one who knows potentially more about the nutrient deficiencies that can be caused by certain medications versus others, and the side effect profile and how they could interact with other medications and those kinds of things. That's literally, so it's ironic, right? Because we give the doctors are the ones that have the power to prescribe, but they're often not the ones that are the most well educated about side effects. So how did you put those two together?
Honestly, I don't really know when it was. It was not with a medical professional. I think it might have been a mixture of like those infomercials. And so another side note, but like it is fallout from this, is now I am very critical of all of my healthcare providers, maybe to a fault, but like to the point where like I have trouble finding providers. And one of them I saw lie in front of me, and another one actually was arrested and had his license put away. So it's like literally I'm just trying to choose providers, sit down and talk with them, have a good relationship, and then things fall apart and that are not my fault. But like, it's just really tough to find like a regular general practitioner that you like. Right now, I think I'm in a good place, but getting critical, asking more questions. I didn't figure it out with them. I think it was infomercials, like reading all of the side effects that come up there and like kind of caustically like making fun of them, like, oh, this, and just being really like critical. I can't think of a better word. I'm just like always questioning whether or not any sort of pharmaceutical is like actually going to help people when there's all those side effects listed. And like, some of them are really, really bad. I know.
Well, sorry, I was just going to say, cause I'm in Canada. So in Canada, I mean, there's other issues with my country, but in Canada, they can't advertise like that on the TV.
Yeah.
So
everywhere right now.
Yeah. So it's
all the time.
We get American TV though. So it's like, but it's so weird from as a Canadian, it's so weird to see like I have the same on like Alexa, like I don't remember what that is, but it's like there's a picture, like a video, and there's like old people dancing or whatever. And then
they're walking up the beach or the lake.
Diarrhea, constipation, heart disease, blah, 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 blah. Your face might fall off. Like it's just
I think I saw, one of those for NuvaRing, and like the svelte, young, happy woman living her life wonderfully, and gallbladder disease. I think I saw that. And I was like, okay. And then your post, honestly, like it's not then that it first hit me, but like it might have been then when it sunk in, and when I was like thinking like, oh yeah, that time, and then this, and then this, and then this, and I was like, oh my God. So like it's really in retrospect that all of those things like kind of come together, and I think honestly, like maybe it's being a woman, maybe it's society, maybe it's all of those things, but like you think you're the one who's got to fix it. It's your problem. Like I was moody. I needed to cope better. I needed, maybe I needed to lower my stress levels or something. Like I didn't think, it just didn't occur to me, except there was something intuitively about your body that's like, I don't like this. anymore. So it's like your head and your body are doing different things, if that makes sense.
Well, at the beginning, well, not the beginning, but a little while ago when you were describing that scenario when you were on the campus and you were crying in the middle of the floor and well, not the floor, but you were crying.
Yeah.
And just all the different feelings that you had and what you to paraphrase, it was kind of like, yeah, it was like I was legitimately stressed out, but my response was just so much more than it seemed necessary, given that I've experienced stressors before. And so that's something that I've heard a lot. I've heard a number of different women over the years say, it wasn't that there wasn't a legitimate stressor here, but it's just that my response was so far outside of what you would think was reasonable. And so, like you're not alone. That's like the third time I've said that. And this is why these conversations are necessary. Like, what else can we do? In retrospect, so now that we know, it's like, okay, if I'm to be put on a medication, I should look it up. I should see if I can find information about it. Maybe I'll talk to my pharmacist. Maybe I'll see if there's a prescribing information available online. Maybe I'll press my doctor a little bit more. Or, for example, if you have gallbladder disease, in retrospect, we can say, okay, so now that this happened, like in retrospect, I wish I would have looked into gallbladder disease and find out if there was a way, because there might not have been a way for you to cope with it, but there might have been a way for you to cope with it or to minimize the symptoms, to minimize the frequency of the gallbladder attacks.
Right.
And then also it might have been useful to have that actual conversation about what life is like after gallbladder disease, or, now we have the YouTube, so you can YouTube people who've had gallbladder issues and find out what they're saying afterwards. So there's a lot of things, but we just don't think of those things in the moment.
Right. And in 2008, we weren't thinking about them.
There was
like
none
YouTube,
of the YouTube, there was no 2008.
No.
That was like the year after Facebook came out. So for all the youngins, pre-Facebook it's a thing.
Yeah. No, if you think like, oh, why couldn't she have Googled? Well, it wasn't your first thought.
No, it wasn't like that back then. Although Google worked back then. So something probably would have came up. Whereas now it doesn't work. Just it really irritates me that Google doesn't work anymore. And I honestly wonder if like the younger generation actually thinks, when I say it doesn't work, what I mean is that they have literally destroyed the algorithm and whatever they want comes up and like nothing else.
Right. There could be something legitimate from a university that you'll find on like the 11th page. Well, that may be helpful.
I feel like back in the day, sorry, we're going on tangent here, but I feel like back in the day, you could go to page 20 and page 25 and each page was different because it was literally page 25. And now I find that page 10, you can't get to page 25. Page 10 is like the same as page 1. It's weird. So it's broken.
And there's sponsored ads all over the place.
Yeah, it's all broken. And then the stuff that you want. So for example, natural solutions to gallbladder disease, whereas in 2000, like ironically, we wouldn't have thought to go on the internet back then because it was just a different time. But if we had, we probably would have actually found some really interesting articles by some really interesting natural professionals. And nowadays, if you didn't know, many of the natural professionals are actively suppressed. They won't come up in a search unless you search their name specifically. So anyways, side note, but I get really irritated when I think about it because it means that it's harder to find alternative information.
Right. And we think that we have more access to information than ever, but we have more access to curated information than ever.
Yes. You put that in a very interesting way. Well, I mean, this is, I don't know, this conversation has been really fun, really informative, really eye-opening in a lot of ways. So the gallbladder disease issue has not come up a ton on the podcast yet, although I did do an interview with Lucy Fink. She was my first gallbladder episode, I guess you could say. Yeah. And I don't remember, I think it was the regular pill, but I would have to listen to it again. So this is a thing. And I think the same comment that I have about this is similar to the comment that I have about some of the more serious issues like the blood clot, stroke, pulmonary embolism kind of thing, because again, it's a real thing. It really does happen. 21-year-olds really do have strokes from the pill. Yes, of course. Again, we're not stupid. We know that not everyone who takes a pill gets a stroke. We're not idiots, but it does happen. And so this is the important part of having these conversations, which is like, first of all, just to acknowledge that it does happen. Yes, it's not happening to everybody. Yes, it is rare. Yes, it is one out of every however many thousands or tens of thousands of women. Yes, sure.
Right.
But at the end of the day, it still does happen. And so I always go back to the same thing, which is with informed consent, there's 3 categories. If you tell, so someone's listening to this and they're like, oh, I was thinking about doing the NuvaRing. And then they listen to this episode. They're like, well, this is way more than I bargained for.
And I'm sorry.
So for that person, so a person in those shoes, there's still 3 options. Some people are going to say, well, good thing I know. They're going to do their research and maybe they'll look at the statistical probability. It's not like it's huge. It's not like 1 in every 5 women who use NuvaRing have gallbladder disease. So we know that everyone isn't going to have it. So some women are going to say, okay, I'm glad I know. And so I'm going to, use it for maybe a shorter period of time. Like maybe instead of using the NuvaRing for 10 years, maybe I'll just use it for this year and then I'll, reevaluate my options. So some other women are going to say, whoa, nope, that's too scary for me. That's too much. Too many moving parts there. I'm going to skip it. And then other women will just use it for as long as they were going to use it anyways. And the key is that when we give the information, then she gets to make that choice. And that's all I want in life. That's it. That's all I want. And then I want for her to know that if she's crying in the middle of her university atrium, that someone told her that your mood issues could be related to your contraception. So instead of her having to find a late night, late afternoon, random commercial on her television, telling her like, why is it the television with their they're legally required to do that. First of all,
yeah, no,
they are not
that it eventually came out.
In case anybody didn't know, these companies are not voluntarily providing this information. They were someone had to sue the pants off of them to make a piece of legislation to force them to provide this. So then, the obvious question is, why isn't my doctor telling us? But if we keep going there and, oh, why isn't my doctor telling me? Like, can we just acknowledge that the doctors don't provide the full side effect profile most of the time? I feel like, even with the gallbladder disease, your surgeon did not provide you with a full profile of life after gallbladder disease. So we have to accept that. Our medical system is kind of not the best thing in the whole world.
Well, it certainly isn't it certainly isn't the end all be all, right? Like there's room for alternative.
It doesn't mean it's not good, but doctors are really good at it's exactly what you said. You're like, surgeons do surgery. They don't do holistic lifestyle and dietary change post-op.
Right. No, I definitely didn't have any issues with my wounds. Like my liver's okay.
I bet you have a really small scar. That right? Scar. So everything he promised you, or she, was it he or she?
It was a he. Yeah.
All right. So everything he promised you was intact, delivered on schedule and as directed. So, but this is, again, I always take it back to the same thing, which is that it's not fair. It's really not. We shouldn't have to be the ones to be doing the research, doing the legwork. We should be provided with informed consent. We should be provided, obviously, we should be provided with all this information, but we have to live in the real world, realworld.com. And so I should look that up before I go to realworld.com. It's like some porn site. No, that's not what I meant. I didn't look it up that night. But anyways, you get what I'm saying. So this is the real world we live in. And so unfortunately, episodes like this are just to empower us. So it means to be that annoying patient. Because it is annoying. And the doctors don't necessarily like to have the patients asking all the questions and being difficult and delaying the surgery or whatever. So what? They get paid either way.
It's true.
So I guess my takeaway for the audience members is kind of like, we do have the right to ask for more information. We have the right to take more time. We have the right to say, I'm going to go home and think about it. Have your canned responses ready. I don't make any serious health decisions unless I talk to my husband, sister, mother, father, brother, cat. So best friend. But I mean, legitimately say, I'm going to take some time to think about it. I'm going to get back to you. Unless you're bleeding out on the table or whatever, you can delay the surgery by a day, a week, a month, 2 months, 3 months, 6 months, a year. I'm not encouraging you to ignore your medical professional, but we can usually take a couple of weeks or a month or more if necessary to look up these things, get a second opinion, have a second doctor provide or a second
find out
surgeon.
how urgent it is. I didn't even know how urgent it was, or whether it was urgent.
Well, and also in addition to the surgeon, you could potentially go to a functional medical practitioner, a naturopath, just for a second opinion. Just, it doesn't mean, again, like the surgical option is still there, or the serious, whatever it is. But again, sometimes as women, I feel like we need permission. Like someone needs to give us permission to go against the patriarchal father figure doctor. We're not supposed to write. We're supposed to be nice. We're supposed to be polite. We're supposed to
just listen to us. We know what's best for you.
I'm sitting cross-legged right now. Like I'm not taking up space, right? All that stuff. But sometimes, again, it's not easy. It's really hard advocating for yourself. It's real out there. But hopefully that's the takeaway. Ultimately that's what I'm taking away.
Yeah. And it definitely did just set me along a path of just continuing my own education, not being bitterly critical of healthcare providers, but really just taking my time in my pregnancy, advocating more for myself, choosing a provider, so this whole process has eventually led me there, but it would be nice if we had that information at the start.
Mm-hmm. Well, I mean, we do the best we can with what we know. At the end of the day, you made that decision to take care of yourself. That's why you made that decision. It's not fun to have gallbladder attacks. I mean, you were young, so you're doing the best you can with what you knew at the time. And so, I mean, yeah, I feel like I'm just grateful that you were able to share your experience, grateful that you found a way to manage with it. Obviously, it wasn't ideal and you've had other challenges as a result of it. So we can't go back and change it. But ultimately, this is what it is. This is real life. This is how this stuff turns out sometimes. And this is the part that they don't want to talk about. This is the part that they just don't want to talk about. They don't want to tell us about.
I'm not the one on that wonderful video.
Yeah.
I can't have salads.
Right? This is the part. And so all of these decisions that are just come back and do the surgery this afternoon. And I think I've shared on the podcast a number of times the time when I was ovulating, but my doctor thought I was having an appendicitis. And he was like, come back at 4 and get surgery. And my mom was like, what? And so she took me to my pediatrician. So she got a second opinion, who was like, yeah, she's ovulating. So they would have taken out my appendix. This is serious stuff, right? We have to remember that. So doctors are people like you and I, and people are not perfect. And that's the end of it. If you take nothing else from this whole podcast, the whole thing, 400, whatever episodes, if you take nothing else from that, doctors are people like you and I. Yeah. Fact check them, get a second opinion. Don't rush. Yeah. Take time. All right. Well, and so now, we went off the NuvaRing. Now you mentioned that you have an 18-month-old, but you didn't come off the NuvaRing and just immediately start having kids. So for anyone who is that I'm aware of, so in somewhere in between there had to be some birth control. So maybe we can kind of wrap up with that. So for especially you and I being of a similar age, coming from a similar time, it sounds like you and I are not in that camp of well, if I'm off birth control, it's just a matter of time until I get pregnant. So maybe share from that perspective how you managed it, because you came off of it for for the reasons of the emotional reasons, whatever. The gallbladder was a surprise, after. But how did you manage your fertility up until you were ready to start trying? And how was that transition for you?
Yeah. So I actually, when that relationship ended and I went off of the NuvaRing, my sexual ethic also changed. And my next partner was my husband, and we abstained until we got married. So that made that part easy. But then when we did, we practiced withdrawal, and it was pretty much perfect use withdrawal. And 2009 to 2020, didn't get pregnant. No scares, nothing. Condoms sometimes when I'm as the years went by and I was actually tracking for fertile cervical mucus, and I could tell. And as my ovulation got more regular, and I got really in tune with my body, I was like, we should probably be really careful right now, but no problem. So withdrawal, condoms sometimes. And that's still what we use. Even after my baby, no more pregnancy, and I'm 18 months postpartum. So I'm sort of proud of that because it's so much easier and it feels really healthy. And I'm so happy to be so connected with my body. And every time it doesn't happen, I'm there's another cycle where I know a little bit more about myself, and it works. And so, because we were doing withdrawal and we're married and we didn't have any other partners, There was no issues with diseases. There's, worry about HIV. Like, we were also like in a place where like, if there was a pregnancy, we were welcoming. So over those years, I did have practitioners like, they were kind of like, do you want contraception?
A real contraceptive method.
Yeah. And to the point where, like I said earlier, when I went to my GYN and I was like, I think we're going to start trying. He was like, all right, well, you're this age. It hasn't happened yet. If it doesn't happen, maybe the repro endo is the way to go for you. So I think the provider was anticipating that I might have infertility.
Using protection. Yeah. That actually adds a little bit of context to your story, because they're thinking, well, they're not really using protection and they're not getting pregnant, so they're probably not going to conceive.
Right. And I remember in the hospital, because this was 2020, they automatically added birth control to my list of discharge prescriptions. And I said, can you take that off? I don't need that. They're like, oh yeah, but we always do this, And I talked to my midwife and she's like, oh yeah, we'll take it off for you. We know. But it still like ended up on there. Like, it was a constant thing that was like automatically pushed. And I didn't even know what kind it was. There was no like brand name or anything. There was nothing, no discussion. So I could have gone home, had someone go to the pharmacy and come home with a pill pack of something. Mm-hmm. Very interesting. I know it was a city hospital. And so I think there's public health reasons why they do that. But like, knowing me and knowing my history, it made no sense.
Yeah. No, this is, and this is one of the things. So whenever I talk about withdrawal, I feel like withdrawal is like the dirty little secret that people don't talk about. So I live in, again, realworld.com. Don't go to the website because I don't know what it is, but I live in the real world. And so in the real world, when I'm having conversations with clients over the years, all kinds of groups and all kinds of one-on-one work, and obviously the podcast and the reality series episodes and things like that. And yeah, there's a good percentage of couples who use withdrawal. It's a thing. It happens. People do it. And many couples use it successfully with no pregnancies. So I can't say all couples are successful with withdrawal, but I would say the majority of people who use it, at least in my world, I mean, obviously you're not going to keep using it. The individuals who are still using it. I know people who've used it for like a decade or more with no scares. So I guess the kind of part that no one wants to talk about is that it actually is a method of birth control. Obviously, like any method of birth control, there are failure rates to it. So officially, the perfect use statistic is 4% or 96%. And the only issue is that some men potentially could have sperm in their pre-ejaculatory fluid. So that's the kind of potential hang up.
Yeah.
But just to kind of validate what you said. So I'm not here saying do it or don't or whatever. I'm very neutral on this topic because, again, I know that it works for people. It works for many couples and it doesn't work for others. And so, but these are, again, like, why can't we have these conversations? Why is it, if you go to Planned Parenthood, you'll see what they think of it.
Right. And I think like the professionals are either trained or maybe through just their own experience to have this sort of negative opinion of people, like they're always going to fail. Or like here's a more realistic thing. And I'm caring for you by providing you this that will help you really succeed because you can't do it on your own. That's sort of the impression that I get. And that doctors see people all the time actually have unintended pregnancies and fail at their diets and everything. So they see all of that. And so I guess maybe they think that way for everybody.
Well, yeah, I think there's a couple pieces to it that I can speak to. One, given that I've interviewed a couple doctors and I always ask them these kinds of questions whenever oh, sweet, I got my hands on a doctor again.
That's awesome. I love those episodes.
Well, it's really interesting. So, I mean, I can link a couple to this podcast episode here, but when you're talking to doctors, it's like some of them, when you ask them how you're trained in medical school, they'll tell you that there is a specific bias, and it goes even beyond the birth control pill. They're kind of trained to, when possible, push birth control options that require no user
failure
participation. So that would be like the IUD and the potentially the implant
or the shot or something.
The shot. I mean, I think the shot is less popular, but at the end of the day, they're looking to make it kind of user proof so that you can't even miss a pill. And so those are considered the highest tier efficacy, and the efficacy is put over all of the other things. So whether it's your personal health or your personal comfort or whatever, the efficacy is kind of put at the top. And so at the end of the day, though, the irony is that you can have high efficacy without hormonal methods. It is possible. Yes, it depends on the person and whether or not they're willing to go that route, but it obviously is actually possible to have it be highly I've been talking too much today, but highly effective. And one of the things too, like a lot of my clients would use two methods, when where you are in your cycle, the days where conception is possible. So that is great motivation to be even more cautious. So moral of the story is really, it's up to you. And no, your doctor may not be super supportive understanding, and that's not really their fault. It's not part of their training. You go to McDonald's, they give you hamburgers. You go to a surgeon, they do surgery. You go to a doctor, they give you medication. Like, this is just how it works. And so, but yeah, without going down the rabbit hole of informed consent again, I think, again, at the end of the day, it's unfortunate that we have to be the ones to advocate for ourselves, and we have to be the ones to kind of push the issue with these things.
Yeah.
But it is what it is.
Yeah. It seems like too, like with hormonal birth control, like there seems to be this like stereotype of side effects. But then like a gallbladder disease is like not in the same category.
Even though it's on the bloody prescription.
Even though it's there, but like, a doctor thinking about hormones, an endocrinologist, an OBGYN is not necessarily thinking about my digestion or my gallbladder. They're taught in medical school, like about the whole body, but like they're thinking about one system. So it kind of feels like there's no one to catch that, thinking, like, that's why nobody would have said to me, oh, maybe there's a connection between your birth control and your gallbladder. Like, I don't know.
Yeah. Yeah. I mean, so the last thing I'll say on that is at some point, I think I was reading, when I was writing the fifth vital sign, and I found it was an informational package about birth control for doctors. And it's very interesting how it read, because it focused on the life-threatening side effects, which is important. It's important to know. Sure. But the way that was presented is that, okay, so we've got the stroke, we've got the blood clots, we've got the pulmonary embolism, but the risk factors are being over 35 and, smoking and being overweight or whatever. And so what that does is it really typecasts, so that if you have a 21-year-old experiencing these symptoms that are specifically about pulmonary embolism and stroke and et cetera, they're thinking to themselves, well, no, they don't have the risk factors. They're not over 35. They're not. So some people pick up on it. I think in the episode I did with Abby Epstein and Ricky Lake, they were mentioning how it's the emergency room doctors often that know, not always, but
they know what happens in practice because they see the result of it.
Well, because if you have a 21-year-old healthy female coming in with a stroke, like this is not
stroke-like symptoms. Yeah.
Yeah. There comes a point when we should be looking at why that's happening. So again, at this point, there's so much out of my control. I can't control how doctors are trained in medical school. I can't control how these, why these hundreds of millions, they say 100 million women are taking birth control. So that means 100 million, doctors appointments. So I can't control the fact that at very few of those appointments, the woman is being provided with a full side effect profile. So all I can do is keep banging my mouth on this podcast, keep giving women an opportunity to share their stories, so that one by one, we can just at least put it out there, so that, because again, we can't prevent all the bad things, but at least if you are listening and you were like, wow, I was getting gallbladder attacks, you can piece it together sooner. Or, wow, like I was having these mood swings. I thought it was just me. It's not just you. It's really not. There's a lot of people that were also having mood swings in a similar way. And so hopefully, that's literally it. It's within my control. And that's why I keep doing it. Well, thank you so much for coming on the show. I mean, to give you the last word, if there's a woman who's thinking about coming off of contraceptives, but she's scared to, or having side effects and kind of skeptical, like, could it really be related? Like, what, if anything, would you want to say to her?
I would just encourage her to do more thinking on her own, do more searching on her own, talk with other people, talk with other providers, read some books, just get yourself informed, and things will make sense when you actually hear about people who've experienced what you're experiencing. And I'd say, especially if they're afraid about the contraceptive aspect, there are ways to avoid pregnancy with without hormones, and you might have to figure it out, but it's worth doing.
Amazing words to end on. Thank you so much for being here, Barbara. This was honestly, I've been having such a good time. We could have just kept talking, but I felt like at some point we're probably gonna have to go eat lunch.
No, I mean, I owe a lot to you. I appreciate your work and your book and just your consistent effort on women's behalf. So thank you.
Well, thank you. That's such a sweet thing to say. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/435. I hope that you enjoyed today's episode with Barbara. I was fascinated by this conversation. Again, talking about a side effect that does happen, but is a little bit lesser known, less well known. And just in general, outside of the specific kind of pill side effect aspect of it, to really touch on that issue that has been a common thread, I would say, of many of the past episodes, which is that when you receive a diagnosis or some information from your doctor with this very kind of rushed, and we need to do the surgery now, and we need to take out this body part now, we need to do this thing this week, or we need to do this thing right away. It's always a reminder, hopefully the takeaway from this episode isn't that we never need medical treatment, because we often do in certain situations, but just take a minute. So a few things to always remember. It's your right to get a second opinion. So whenever you're provided with any type of information, diagnosis, given a directive that you have to go and get this procedure right away, unless you're literally about to die, bleeding out on the table, I know it's a hyperbole example, but still, unless it's that severe that it's something immediate that needs to happen, which in most of the time it's not, then you do have the right to get a second opinion. And it's a good idea to do so. And so that could be a second opinion from another medical doctor or from a specialist in that particular area, whatever the area of the body or the area of health, or a person who is a functional doctor who is not a medical doctor, or who is also a medical doctor, but coming from a functional perspective, even to give you a different perspective. Is there anything I can do to treat this? Is there anything I could do to minimize it? Do I need to go ahead and get this procedure done right now? Is this something that could wait a week, a month, 6 months? Is this a situation where we could take a wait and see approach, where I could try to address it with other means and see if it could improve? Or is this really as dire as it's being told to me that I have to go ahead with this procedure right away? So I think it's always really helpful just to keep that in mind, because over the years, I've just spoken to so many women who have felt pressured to do something right away before they could even think. So the appointment's booked, everything's done before they can even have a moment to think. They haven't had a chance to research anything, read anything, even see if there's any Facebook groups of women who've had gallbladder disease, and so they can learn about the pros and cons of having the gallbladder removed, for example. And this general circumstance could apply to a lot of different situations. So before we have the ability to really inform ourselves about the situation, we're already going ahead and having these procedures. And then often in retrospect, we look back and think, okay, well, maybe if I would have known this or that, I would have delayed it, or I would have tried this, or I would have done something different. And so, we do have the right to do that. So hopefully that is the takeaway from today's episode, that it's always within your right to get a second opinion. And even if you do end up going ahead with whatever the procedure is, at least you'll have known that you did everything you could to look into it, and that you were the one that made that decision, not that you were pressured into doing it. So with that said, I hope you have a wonderful weekend, whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting.